Okay, we are live.
Call this Board of Health meeting to order. County building ordinance, the county has a mask mandate, and you, sir, will have to put a mask on. So we'll open this up with the mask mandate as the first thing on the agenda. We have a limited number of people here, so we will accept public comment. You have a 3-minute limit. Since we don't have a large number of people, we will accept people who have already had previous comments. So we will start with public comment right now. Please address the podium, state your name, give your statement, and we'll move on. Anybody got any public comment?
I'm J.B. Howick, and against any form of mask mandate. I spoke last week, and I'm grateful for the chance to speak again. I am against, indeed, any further mandates of any kind at all at the state or county level. As an engineer, I'm trained in statistics and the scientific method for developing accurate statistics. As a marketer, I'm trained to understand and how to manipulate statistics. Since the first days of the pandemic, I've seen very little of the former and a great deal of the latter. The simple truth is that the numbers just don't add up. It is not surprising that the graph of COVID illness looks identical to the 2018 DHHS chart of seasonal influenza, or that the number of people nationally who have died only of COVID-19 is nothing more than the number of those who die seasonally due only to influenza. It is somewhat surprising to observe our country blindly accepting a diversion from nearly 20 years of CDC-sponsored and proven data reporting concerning infection, comorbidity, and death in favor of reporting methods that make it look like everyone is suddenly dying of nothing other than COVID-19. It is also somewhat surprising that people are not reacting to the vast shift in wealth due to this disease. Hundreds of billions of dollars worldwide have been spent on tests that the Nobel Prize-winning inventor of the test claims are being misused, and on vaccines that apparently work so poorly that Dr. Anthony Fauci, who I no longer trust, believes we will need to continue to require masks, quarantines, and lockdowns. But it's no surprise that people have had enough of their boards of health damaging businesses and family livelihoods. This is clearly reflected by the fact that the Montana legislature is or has been considering 5 bills designed to limit the authority of local boards of health. These are House Bills 121, 145, 236, 269, and Senate Bill 108. And of course, Senate Bill 65, which protects Montana businesses from liability due to state or board of health actions and emergencies. But most importantly, this is not an issue concerning face masks. It's entirely an issue of precedent. Our society has allowed itself to be led by a flaxen cord, setting the precedent for casual acceptance of much stronger bonds. The damage these bonds can create and have created is measurable. I quote from an article, COVID-19 Data Collection, Comorbidity and Federal Law, a Historical Retrospective, from the online journal Science, Public Health Policy and the Law, quote, as a result of state policies based on potentially compromised data published and promoted by the CDC, Americans have lost jobs and businesses in historically unprecedented numbers. At the peak of the crisis, an estimated 20.5 to 42 million Americans had lost their jobs without having any voice in the decision-making process due to shelter-in-place mandates issued by every state, with the exceptions of Arkansas, Iowa, and Nebraska, South Dakota, Utah, and Wyoming. Anxiety, depression, suicide rates, domestic violence, and alcoholism have all reported had risen significantly due to the economic hardships brought on by how state governors decided to exercise their authority in response to the potentially compromised data published by the CDC. Public health policies that create more collateral damage while attempting to avoid an infection with a 99.05% rate of recovery in the vast majority of citizens must be objectively investigated and critically questioned if the goal of living in a healthy society is to be realized, close quote. I conclude by stating that never again should we harm livelihoods or our economy. A year ago, this board and the county shut down festivals and activities that harmed our economy and lowered the quality of our lives out of, among other things, a fear of someone might file suit against the county for a failure to establish mandates. I, for one, am most certainly to the point that I'm willing to file suit against the county for any continued effort to compel its citizens and harm its businesses. No mask mandate. And when the state finally releases them, no social distancing mandate or lockdown mandate. No longer should any business or community organization need to seek permission to hold valuable and vital activities. It is long past time to return to the people their right to free assembly. The period of seasonal illness is closing, and with it, we should return to what is truly normal. Thank you.
Kim, the county has a mask policy in all county buildings, so you're gonna have to put on a mask.
Okay, let me ask you a question, and I'll ask for an answer. Under what law is the policy made under?
It's the county policy in county buildings to have a
I
mask.
understand what you're saying. I have not seen the policy, but I asked what law is the policy rendered under?
All I know is it's been approved by our county attorney to have a mask mandate in county buildings.
Okay, one more time, sir. What law?
Corey?
I'm looking it up here. The general authority of county commissioners under 7-5-2101 would be appropriate to give county authority to govern that specific issue for county building. I don't have the resolution in front of me that the county commission passed, but I can continue to give you another citation if you want.
With all due respect, Mr. Chair, members of this committee, I'll leave you my card. And I will ask respectfully that you give me the law that you're standing on that trumps my rights, as well as the rights of the other citizens of this county. With that said, I will expect a written response at your earliest convenience. Mr. Attorney, thank you.
I have your email.
We've already been down this road once, and I just don't understand why it just keeps coming back to infringing on the rights of the people.
Is there any other public comment?
Robert Michael, the manager of Rocky Mountain Supply. Want to say thank you all for giving us the opportunity to speak one more time. I'll keep it pretty short. I just want to implore you to consider what the businesses are put through on any sort of mask mandate. I understand where the idea is coming from, but I believe we had an instance today that shows exactly what the businesses are put through if we are told that we need to force a mask mandate on our customers. A person walked out of this building today because of that. People walk out of our stores because of that. That is the risk that gets put on the businesses with that. We've been under one for a long enough amount of time. I believe at Rocky Mountain Supply, we did what we could to try and enforce it without harming our business. And I think that we have tried to work as well as possible with the county on that. But the stress that we have been put through, that our employees are put through with the attitudes of customers on both sides of this, is something that I don't believe we need to be forced into any longer. I think that there has to be some consideration, and I ask each of you to please keep that in your mind of what this puts on the businesses if you do put forth another mask mandate. Thank you.
Thank you. Any other public comment?
Mike, I have one from the hospital. Should
Okay.
I speak that now? So, Leota Gormley, Billings Clinic, Broadwater. As a facility, we are continuing universal masking for all staff and patients that enter our facility. And we support the county to continue the mask mandate. We do still have COVID in our community, and we also encourage everyone to continue with social distancing and hand hygiene as well. Thank you.
May I ask a question? What is the metric?
Address the podium, please.
My apologies, Mike, sorry. My apologies. A quick question, what is the metric to conclude that decision and desire?
I do not have that in front of me right now.
There is no disease that ever goes away. Once it's here forever. So the mask mandate, you just suggest it's going to go on forever. I'm just curious that if you wish it to continue, when do you believe it should stop?
And that, I believe, is something that can be determined between this board.
Thank you.
Thank you, Yoda. You got anything else? Dwight, do you have anything?
Yes, I do. Could I address the public and the board at
Yes.
this time of this? Well, first of all, I apologize to the people of the community for last week that we weren't able to have a quorum here. I was able to look at the videos and the discussions that took place, and I just couldn't be here, and we just didn't have a quorum. So I apologize to people that took the time to be here and leave comment. A little background: I served three terms on the school board, and when these decisions come up that were tough, I always tried to make the decision that was best for the student. I was also on the board of medical examiners, and again, that board was to protect the public, and I tried to make the decision what was best for the patient when tough things come down. This board is different. We have the ultimate responsibility of taking care of the whole community with some of these decisions. Just west here, by the way the crow flies, is an old ghost town called Elkhorn. Has anybody ever been up there? You've been to the cemetery? It's an eye opener. And the history with Elkhorn, it has two distinctive features: is that most of the mining towns of the era were brought in by single men trying to hit the big gold mine and prosper. But Elkhorn was a community that was made up of immigrant families that came here. And in 1888, at the height of the silver production, Elkhorn was hit with an epidemic called diphtheria. And it found that every week people were burying half of their families, and then a week later they were burying another half of the half that was left. And the families that had lost the husband and stuff, they left overnight. And Elkhorn went from a town of 2,500 people to almost zilch. Part of it was because the gold market dumped at the same time. But the thing with diphtheria is it's a virus spread just like the flu and COVID. A simple mask probably would have stopped that epidemic from happening. The mask wasn't invented for another 9 years. And I bet those families would have been crawling over each other to get a hold of a mask if that's all it would have been taken to stop this thing. I'm no expert. Even somebody mentioned Dr. Fauci. This is his first go around too. He's never been involved with COVID. But this community has 5 experts that know a lot about COVID. And these 5 chairs in front of us represent those people. They can't be here today because they're dead. That's how many people we've lost in this county to COVID. It's our job as the board to make sure that no more chairs start stacking up here. I don't know what's happened with society that death has lost its fidelity, or what's happened with it. I thought it was young kids that were playing video games that blow each other up and then hit reset and their life's back together. But I've been hit on the side of the head by people my own age and people much older than me that think that because one of us are gone today or tomorrow, we just replace them. There's 5 people here that, yes, maybe been in your store, and you maybe lost out on that $5 purchase. But these people will no longer ever, over a lifetime, have those purchases to your store. I'd like to address a little bit that I picked up from the community questions and stuff last week. One is we can't enforce wearing a mask. I agree with Wynn. He can't enforce it. We can't expect him to enforce the mask. The question is why we have an enforcement. Maybe we should replace the word enforcement with education. To me, it's common sense that we just need to be watching out for each other, our sisters, our brothers, our employers, our employees, the lady behind the desk, the offices. It's not a hard thing to wear a mask. It's an inconvenience. I hate wearing it more than anybody else. I wear it all day long. I like to get home at night and take the doggone thing off. It's an inconvenience. I still go into the stores and shop. I still need to buy groceries and buy hardware stuff. Doesn't stop me from doing it. My concern is that this virus is mutating. We see it. The problem I have is that some people get their news from fake news. What happens tomorrow if this vaccine that we're trying to get out is no longer valid? It's mutated and it's resistant. We're back to the days of the people at Elkhorn. I see the other counties around us most of the counties around us are taking the steps that continue the mandate. I think the people here, we can rise above that even. We can make our county as safe as any other county. Well, we have a problem that we have a busy highway going through here. Well, probably one of the busiest 2-lane highways in the state. A lot of people go through here. But we can at least show respect for each other by trying to protect each other. This mask is protecting you. I like to go into a store where I see the employees wearing a mask because they're protecting me. So if anybody else wants to come to the podium and give us some ideas of how to keep these chairs from multiplying, I'm all ears. That's all I have, Mr. Chairman.
Thank you. Debbie, you got anything?
I will. I'm not a health professional. Have the utmost respect for health professionals, have some in my family. I am not for a mask mandate. I have studied it. I have listened to many business owners, individuals. I am for mask. Don't get me wrong. I've been wearing one since March of 2020. I respect any business that says no mask, you can't come in, or you don't need a mask. It gets back to personal responsibility in my mind, and that doesn't mean you're selfish. It means you care for others. If there was a mask mandate that had enforcement, I might feel differently, but there's no enforcement. Education, absolutely, 100%. But I think people have been educated, and I think at this point, they need to make the decision for themselves, their family. I didn't go to any functions personally all spring, all summer. I was invited to a lot of barbecues. I didn't go. I took that seriously to protect my household and their households. They did, that's their choice. But I don't think a mask mandate changed anybody's opinion or what their activity was. I completely support the school for making their own decision, and they have the right to do that. A business has the right to do that. As a commissioner, we have the right and the responsibility to do that in this county building and in the other county building. So it's kind of I'm contradicting myself, but I believe in that personal decision for what everybody can do for themselves. And bottom line, I'm still going to wear a mask every chance I get, and I hope other people will. But I do believe the mask mandate is a little fake. And along with mask mandate, it's not just mask. Social distancing, washing hands, staying home when you're sick. That is my opinion. And I've heard from so many people that share that. And I think I need to represent that also. Thank you, Mike.
Thank you.
We do have public comment on here.
Okay.
Cheryl Campbell says, I'm watching. Even Dr. Fossey in a recent interview said the masks don't work. So, do I need to read that again?
Well, I'll start this off by saying I don't know where I'm at. I've spent the last 4 or 5 nights not getting a whole lot of sleep. I think the things that we have to consider is that the isolation and quarantine order is still in effect. So if you have someone in your on your staff that has COVID and they've exposed the rest of your people, those people are still required to isolate and to quarantine. Once again, I don't know what the enforcement of that is. The other thing is the schools. The kids have put up with the mask, as have the rest of us, probably with a little more enforcement than the rest of us face. And I think it would be a mistake to not support the schools, because the kids have already gone through one spring where they didn't get to participate in any extracurricular activities at all. The track, the FAA, the industrial trades programs all have programs. They all have to do them remotely now. They, like us, don't get to have that companionship in the competition and see people that they've known for 2 or 3 years. It could be that their senior year, they don't get to see those people. I know my daughter went through that, and I don't think she was very happy about that. And the other thing is our senior citizens. A lot of senior citizens have not. I mean, I know a couple that haven't been out of a house since March of last year. And their effort on their own behalf, I would assume it would continue. However, I think that we would need to have enough responsibility that we're not going to infect those people or expose them in any way. So I think the thing that the governor's mandate is that individual responsibility remains Montana's best tool to combat the spread of COVID-19. Montanans are encouraged to wear masks and should follow the best industry practices adopted by any business they visit to slow the spread of the virus. And I think that's very, very individual responsibility. It's not individual responsibility not only for yourself, it's for your neighbors, for your senior citizens, for your family, for your people that are very susceptible to the disease due to underlying medical conditions, of which I have, and I will probably continue to wear this thing until I get my solution taken care of. I don't know when that'll be. Like I said before, I really don't know where I'm at. That's all I have. Sean or Teresa, do you have anything?
I do, but there's also someone in the public here that.
Okay. You have to put a mask on, please.
I can talk extremely loud and talk from here. I don't believe in the germ theory. Read the book, Pasteur versus Bouchon. Go and read The Invisible Rainbow, or read Technocracy Rising. Read them all and get your education. This is all BS. The reason why I say that, I'm a hairdresser. Been a hairdresser for 35 years. The only time I was ever sick was when I received the flu shot. What happens? It takes down your immune system. You become very ill quick when you're around other people that are sick. When your body is not garbage, it doesn't attract the flies. So, being that my children are not vaccinated, I did not go get the flu shot, why did they put the flu mortality numbers with pneumonia mortality numbers? Why? You know what? You want to know why? So that they will sell more vaccine. So, your COVID numbers, why is there no more flu? Why? If you already have a pre-existing disease, then you catch horrible things. You can catch flu, you can catch it, I guess, but there's no flu numbers. So if your body, if you treat it like a machine, and you put your mask on every day, and you breathe your own CO2, just think of it as if you were going to sit in a car, idling, and plug up the muffler. Would you do that unless you want to commit suicide? Would you set your house with your air conditioning unit outside, packed with leaves and whatever's growing around it, getting packed with dirt and mud? Would you not clean it? This mask thing is hocus pocus. It's a lie. And if you want to wear it, as I'm standing next to this man, I'm not practicing the social distancing with him. But if we were having sex, then wear the mask. But you know what? We're not. If that works for you, then by God, you wear the mask. I don't care if you fill up those chairs. I really don't care. But I'm not going to ruin my health where I have asthma and wear a mask all day and get sick and accommodate stupidity.
Mr. Chairman, her time is up, and we need her name for the public record.
Oh, we need your name, please, ma'am.
Gina Satterfield. Pasture versus Bouchon. Invisible Rainbow. Amanda Vollmer. Look her up on BitChute. Start talking to your naturopaths if they haven't gone the way with the regular medical system.
Mr. Chairman, I would ask that she's not wearing a mask and her time is up.
Thank you.
And there's public comment.
Yeah.
Thank you. Simon Burrow, when did we become responsible for other people's health? Are we going to start controlling what people eat, whether they smoke or not, if they drink themselves to death? Where do we draw the line? Cheryl Campbell says the mask requirement is killing the ability to think logically with common sense. It's killed our economy, jobs, and businesses. If fear isolates you, that's your problem. No more masks. And then Bobby was asking who was speaking, and let's see, that was it.
Thank you, Helen.
Well,
Men won't have to ask you to either put a mask on or step outside because our county policy is to have a mask on in the county building.
County policy, where is it constitutional?
It's the county policy.
It's a policy. Is the sheriff going to come and arrest me because I don't see him wearing a mask either?
You
When are you guys
can,
going to get it straight that you are not God?
you can either put a mask on and stay in the building, or we will adjourn the meeting and no decision will be made.
Have a great day.
Thank you.
Whatever.
Does anyone have anything else?
I do
Sean?
have a couple comments,
Okay.
if I can. So this is Sean Rowland, I'm the interim county sanitarian. I just spoke with the public health nurse from Jefferson County, and she gave me a little bit of explanation on why they went with the directive. She indicated the same issues that we have in terms of enforcement being very difficult. However, she said that the schools came to her and said without a directive from the county requiring masks, it's very difficult for them to enforce, and that was came somewhere from the state public school instruction. I can't, it was such a quick conversation, literally while I was walking over here. In part of what she indicated is if you'll see in their directive, it says until the completion of phase 1C vaccinations. And that's because the teachers were taken from phase 1B, I believe, and put into phase 1C. I don't know how that plays into what we're talking about, but I think it's important that no matter what comes out of today's decision, is that the board, I believe, with the school district here last week, the superintendent of schools, the principal, and one of the board members really asking for support from this board, and the board basically saying, yes, we will give you that. We need to indicate with a statement of some sort saying that we will support them in any way that we can. And if that means that we need to do something more specific to the schools down the road to help them keep the schools open, keep the mask mandate in the schools, I think, anyway, I'm just throwing that, that's an important issue that needs to probably come out of this meeting no matter what. And I think it's important not only for the schools, but also any of the entities that are going to require masks, including yourself. You see how the issue is here with something strong saying if someone requires it, if a business requires it, they have the ability to turn people away based on the mask issue. I think that's just an important issue. I think it's important too that we've heard a lot of discussion from the public that masks don't work. I think that we all know that masks work. I think there's a lot of misinformation, but there's a lot of information and common sense telling us that the masks can work. I'm not saying that I'm not telling you to mandate it. I'm telling you that I think we need to at least say that masks work, but also there has to be an understanding that it's not just that the masks work. The masks, it's both people or all of us in the room wearing them together, because I'm right now, I have water droplets coming out of my mouth. So the mask for me is stopping that. For you right now, while I'm talking, it's keeping those droplets from entering you. So it's a recognition that it takes everyone to be using the masks for it to work. And the masks have to be fit properly and that type of thing. So I think it's important that we understand that. Furthermore, I think it's important that we understand that masks are not the only solution. It's a full solution. We have to talk about social distancing still. From the CDC, we came out with their morbidity and mortality weekly report on the 10th, and it said until vaccine-induced population immunity is achieved, universal masking is a highly effective means to slow the spread of SARS-CoV when combined with other protective measures, such as physical distancing, avoiding crowds in poorly ventilated indoor spaces, and good hand hygiene. So it's important that we look at it, that there is still more to this than just wearing a mask, and we need to be promoting that as well. Even in the governor's directive, it talks all about that. If the policies that are put forward for best practices for a business, if there are no policies, then we need to follow masking, social distancing, temperature checks, testing, isolating, contact tracing, sanitation, disinfection, and promoting telework. So I think it's important that what comes out of today's meeting is the support of these ideas that masking works, that there are other things that we need to be doing as well in our community and promoting those. Now, it's fortunately not my decision to come forward with that, but I think it's something that needs to be supported, whether it's mandated or supported, should versus shall. And I think the last thing is, once again, this individual responsibility. Responsibility is not just me taking care of myself. It is me thinking about my community. And so if my community is Broadwater County, we need to be thinking about how can I be helping my community. So if wearing a mask is going to keep businesses open longer, we're not going to have to shut down businesses, then I think we need to think about how we can do that as a personal responsibility to help our community. So, and yes, Robert's been, I just want to commend him. He has been very, he's communicated with me. He's, asking an $11 an employee an hour to go through what you just had to do with someone here. That's just not like something that we can expect. But I think we need to have something that comes out of here that strongly indicates how important it is to look at this thing as for our community and do what's right for our community. That's it.
Thank you.
We do have more public comment on here. Simon Borg, diphtheria is different than COVID in that one is bacterial and one is viral. Recent studies have shown COVID viral can survive on objects for up to 28 days, whereas the bacteria that causes diphtheria can survive for up to 6 months. People back then were at a much higher risk for developing diphtheria than people today have of getting the COVID virus. And then Larry Gibson, none of these stupid restrictions, social distancing, masks, and so on, have any appreciable effect. South Dakota has been a free state all along, and their numbers are not very different from ours. And that is it.
Thank you.
Mike, there's another gentleman who wants to speak.
Yes. Yes. Did you have a comment?
Paul Lord, resident of Townsend. Why are you guys trying to enforce something that nobody's going to do anything about, Mike? That's what I want to know. Does it make you feel better at night? You know what? Everyone remembers the past. You feel better now? Can you answer? Do you feel better now? I can go into any store and I'm good with this. You know what it is? It's for fishing. It's a sun protector. Is that an M95? People walk around. They're not certified masks. So you sit there and say, oh yeah, it makes everybody feel good. And nobody's going to enforce it anyway. Tell the people that like to wear one, that makes them feel good. I wear mine every time a business says so. But to try and shove this down when nobody's enforcing it, the county attorney can't find where the law is. It's been going on for a year. You'd think you'd have it together. Appreciate your time.
Is there any other discussion? I guess we need to have a motion or have a vote, or somebody wants to put forth a motion?
Corey's got his hand up.
Corey has a question.
Okay.
I guess I'll want to offer a couple thoughts on this. One is if you don't do a countywide mask order, I do recommend that it would be good to do under the public health laws. It's 50-2-116, authorizing the school district to impose a mask mandate regulating their property, their students, faculty, and activities. And I think that would be appropriate. Secondly, is if you don't do a countywide mandate, but you want to maintain the one in the county buildings, the county commission has that authority, but I think it makes sense to double assert that from the county board of health. And I don't know, are we going to talk about isolation and quarantine orders today? Is that on the agenda?
What's that?
Is that on the agenda, talking about the isolation and quarantine orders?
Yes.
Okay, I'll cover that when we get to that. I guess I would offer you two things. First of all, I'm looking at these statutes, and I'm looking at the administrative regulations, and the statutes with these quarantine and isolation measures and the public health officer and the public health board were first passed in 1967. Not in this exact final form, but this isn't a brand new thing. The administrative rules were passed first in 1987. The isolation of a patient or the quarantine of a patient, those have been in place for 30 years. And obviously that's because we understand, I don't agree with the comment that germ theory isn't a valid scientific basis for dealing with public health issues. But I would say this, I would say that when it that there's, as a governing entity, you have to reach this point when you say, is our action going to be effective? And, I honestly don't think that a countywide mandate, in terms of enforcement measures from the sheriff's office or from my office, I am going to spend some resources, and I'll talk about that when we get to it. I'll spend efforts and resources on quarantine and isolation. I just think that the ability of my office and his office to enforce a mask mandate, it's literally missed. It's missed. It vanishes. It's not feasible to do. And I think if it doesn't make sense to issue a mandate if you cannot enforce it. I do agree with and I have been saying this is, and honestly, this is what I told the governor over a year ago, Governor Bullock. We had this meeting with all these sheriffs and county attorneys, and he said, we're thinking about doing a mask mandate. And I told him, don't do it. You need to continue to encourage people to do it, educate, ask them to do it, because it may help, but a mask mandate's going to overly politicize it. It's going to cause a backlash of resentment, and that's exactly what happened. I think if he hadn't done a mandate then, if he had done a, care for your neighbor kind of thing, I don't know. I have no idea I don't know if the numbers would have changed at all. I think maybe it would have been less contentious as an issue in our communities. So that's my view of where we're at today. Minds are pretty made up on this. People are pretty solidified. And I honestly think that the most effective thing to do is to, in places where you want to ensure that it's enforced, like if you want it enforced in county buildings, or you want to, healthcare facilities, they're going to enforce it. I mean, you walk in that door and they're going to enforce it. I was in a hospital visiting someone last night, and they're enforcing it. You're not going to see a patient without wearing a mask, and that's how it is. Schools, clearly, if they want to enforce it, and this board should empower them to do it. But countywide, if businesses want it, or if people are going to wear it, they're going to wear it. If they're not going to wear it, they're not going to wear it. And I think that there's a certain level of fatigue that's set in, clearly. These numbers with these new strains, I don't know. I don't know if we're going to see this thing going down, or we're going to see it spike, or if this is going to be an up and down thing for the next several years, or what it's going to be. But just in terms of the practicality of local government, that's my recommendation.
Thank you.
Mike, does Dr. Campbell have any comment on?
What's that?
Doc, do you have any thoughts or ideas?
I agree wholeheartedly with the county attorney.
So does anyone want to make a motion?
We have more public comment.
More public comment.
Okay.
Cheryl Campbell says, please, once again, no more masks. Melissa Duncan, I have a coworker who has had COVID within 90 days twice. She followed all the rules, mask, social distancing, etc. Masks do not work. Show respect to everyone, not just those. And Melissa Duncan, again, who want the mask mandate. I believe we are adults and have a right to ourselves. If we don't want to wear one, good, let us be. And Joey Brake, please address the need to submit group plans for events. Will this still continue? That's it.
Thank you. So I guess if no one's going to make the motion, then the mandate would be in place as what the governor has recommended, so there will be no mask mandate. This is an issue that we can revisit, and I would suggest that we keep an eye on numbers until next month. Hopefully they won't spike. Hopefully everybody will be responsible for themselves and for their neighbors. I hope businesses recover the way that they seem to think this is hindering their business. I would hope that they will recover, but the thing that you need to remember is that isolation and quarantine orders are still in effect. I don't know who enforces those. So I guess we will.
Mr. Chairman, I have a question about that.
Yes.
It's for Corey, because I don't know. if there was no motion, does the current mask mandate stay in place? How does that go?
So there is not a statewide mask mandate. That's, the governor ended that on February 12th. And so if, my recommendation, and I know the school board passed one for their facilities. My recommendation is if you're not going to do a county mask mandate, I recommend you do pass an order authorizing and basically supporting the school board's decision to govern their facilities, activities, students, faculty, et cetera, in their buildings to have a mask mandate. And I would also encourage you to pass one for county buildings and facilities, and maybe say if requested by, or if
So there'd have to be,
affirmed by
there'd
the
have to
county
be
commission.
a vote. Right?
Yeah, I
Otherwise,
think
you stay
so.
on the current.
I mean, the school board's continuing to do something, the county commission's continuing to do something. Those are relying on their general authority as governmental entities governing their facilities. I think it makes sense to, as a local board of health, affirm those. But there is no statewide, you're right, there's no statewide governor's mandate.
So the next item on the agenda is quarantine and isolation orders. You want to give us something on that, Corey?
So there was a directive from February 12th from Governor Gianforte that took effect February 12th. And his first one, when he first took office, had kept in place all of Governor Bullock's directives unless he specifically changed them or repealed them. That was in January. So the February one said, we're repealing everything except for what's in this specific directive. He got rid of the phased reopening plan that had been kind of the Bullock approach last year. And as I was going, so he said, everything's repealed except what's in this directive. So I'm going through this directive repeatedly, and I'm not seeing anything on CDC, implementing CDC guidance for quarantine or isolation. So quarantine of suspected cases, isolation of confirmed cases, patients for a period of time. So we talked about it. I kicked it around with other county attorneys and health folks, and they were saying, well, they had adopted a county one, so regardless of what the state does. I ended up talking to the governor's legal counsel, and we went through it, and she agreed. She said, we do not have it in place. We left that to the counties. So there is not a state-mandated quarantine and isolation public health directive in place at this point. And as I understand this board's actions last year, it was basically we were relying upon and implementing what the governor had done. So my recommendation is that you do, as a Board of Health, adopt quarantine and isolation measures specifically for COVID, and then authorize the public health officer to issue specific quarantine and isolation orders on individual cases as they become aware of them. Okay? And the reason I'm saying that is because the general authority of the Public Health Board, and I'm looking at 50-2-116, and it would be specifically F little 3 and little 9, and I'll just read it. In order to carry out the purposes of public health system in collaboration with federal, state, and local partners, each local board of health shall identify, assess, prevent, and ameliorate conditions of public health importance through isolation and quarantine measures or other public health measures as allowed by law. Then you go to the powers of the public health officer, and that includes taking steps to limit contact between people to protect the public health from imminent threats, and establish and maintain quarantine and isolation measures as adopted by the local Board of Health. So I think the Board of Health needs to establish those measures and then allow the public health officer to enforce them through his authority under law and as orders, okay? So what we've been doing and what's been proposed, I think is I'm not recommending a change from what the practice has been, but I do think it's important for the board to go ahead and pass that so that he can continue to operate as he's done. As far as the technical stuff, I'll defer to a medical person, but that'd be my recommendation.
Did you have anything, Teresa?
Yeah, so for the purpose of this isolation and quarantine, for public health, we're required to have a quarantine letter and an isolation letter. Those have actually been developed twice because isolation and quarantine did change. And so I changed the letter with that, and so people that test positive for COVID get an isolation letter, and the people that are under quarantine get a quarantine letter. These I tweaked from a group that we have at the state. Pretty much a lot of the public health departments are using this very same quarantine and isolation letter. I tweaked it for our county and was approved by Dr. Campbell. Some people need them, some people don't. If they require them for their work to get paid, we send them out. Not every single person gets one. I mean, every single person is getting a contact call now because our cases are down. And so we do have these in place. If anybody wants to see them. Actually, the ARM is on the isolation one. You saw these, didn't you?
Yeah.
Yeah. I would recommend that we continue to use these. I've only had a few instances where people will say, no way, I'm not doing it, I'm going to work, that kind of thing. And we were instructed by the state to gently suggest that we would contact our local law enforcement. It works. I mean, gently with some of those people you have to say, you can't go to work. That's the way it is. And so I don't know if they do or don't. Some of those people were from East Helena, just happened to be in Broadwater County. So we do send out the letter to those people for sure to make sure that they, get that. And we take a copy and put it in a medical record. So.
Mr. Chairman, may I ask Teresa a question?
What's that?
Can I ask Teresa a question?
Yeah.
So, does everyone who tests positive for COVID receive this letter or these letters?
I would have to ask Cammie for sure. She is the one that's doing our cases right now, if she's sending them out to everybody. When we had 50 cases, we didn't have the time or the staff to do it. So, now our cases are low, are lower, so we can, send them out to everybody, I'm sure. But, it's never been brought up at the Board of Health. And so, it's just kind of a reminder for those people that, we've called people and told them to be in quarantine, and then the very day they take their kids out trick-or-treating, without a mask and everything else. So, there again, it comes around to enforcement.
I have another question.
Yes.
Corey, I guess this is a question for you. Can the Board of Health require, if you test positive for COVID, the Broadwater County Health Department must, for lack of a better word, give you one of these written letters, one of these letters?
Give me or give the person?
Give the person. Sorry.
Yeah, I think you need to, because for number one, there's a lot of actually very good information in that. Number two, you can't really enforce an order like that unless you have proof that you've actually given them notice, given them the information, et cetera. And so I think that's an important measure to do. And I mentioned this earlier. So I've had an opportunity to hire a deputy county attorney. She'll be starting in a few weeks, and this will be one of her duties, is specifically to help all legal issues with the Board of Health, with the health officer, et cetera. So my expectation is that we'll have an opportunity to spend some more time on this. But again, this is kind of why I kind of said what I said on the mask. I mean, I think that's a much more difficult thing to enforce. This, I think is not only has it's more amenable to enforcement. I also think it has a much more articulable rationale and ability to enforce. So that's my view. But I agree, you can't really enforce it if you haven't actually provided this notice to them as quickly as possible. And that's the other issue, is the contact tracing with, every county in the state was overwhelmed at the same time. So contact tracing, I'd be surprised if 10% of the people were getting contact tracing that was thorough within 24 to 72 hours. And if you're beyond that, that's almost pointless in doing it. And so that was a big factor, I think, in the summer and fall, really fall, of our numbers coming up so high. And I'm hopeful that with the numbers changing a little bit, we can do contact tracing more effectively. Part of the issue is Montanans are so mobile. I mean, they're going to be in other counties or even other states, depending on what our tourism looks like this summer. But, a lot of places in the country are horrible, and people are going to want to come here this summer.
So is there a motion to adopt the isolation and quarantine for COVID-19?
I'll move to adopt the quarantine
Is there a
letters that
second?
we have.
I would second that motion with the caveat that these letters are sent out from the county health department,
Okay.
that it is more than a phone call.
Motion's been made and seconded to adopt and approve the management isolation quarantine for COVID-19. Is there any further discussion?
So I have a question. So if the CDC were to change the duration like it has, would we need to vote again, or would we just kind of go with that, just can have her update the letters?
I think we would just
kind of go with
stay
CDC
with it,
recommendations.
yes.
Okay.
Any further discussion? Yes, Court.
And I don't know if anyone wants these documents. We've got piles of them over here to look at. It's not clear to me are you planning to basically adopt this? There's a 4-page policy document that's written on it. I think if you adopt the policy document, then the health officer can use those order templates that Teresa has, and she can adjust those based on the CDC guidance, because that was my concern. It may change.
Yeah.
I think if you adopt the policy that basically says you'll implement the quarantine and the isolation measures, you'll do the contacts, and then depending on CDC guidance on length of duration or whatever it might be, this will change when when vaccines are fully implemented potentially. So I would expect that even by summer you're going to see probably enough CDC changes. You may need to come back and revisit this.
Okay.
So, do you have that policy document?
You should have.
They were all forwarded.
Oh,
yeah,
they look like this.
This one here.
Yes.
So
And-
I actually had to change that. Leota and I spoke this morning, and the guidance for, people who have their second shot has came out. And so I took the last page, you guys don't have it, but I can forward it to you, is specifically for people who have received their second vaccination. And that just came to us last week, and so I didn't get that on here until this morning. So I'll re-forward this to you, this policy, because there is entirely a different guidance for quarantine for people who have had their second vaccination.
And Leota forwarded that to us yesterday, so we all have that
Oh, yes.
as well.
Okay.
So I just added that
to
to
the policy.
Yeah, I just added that to the last page.
So I guess Dwight, you'd have to amend your motion to,
Include a policy.
yes.
I
To
just make,
include-
I
to
just move to
include the
make an
CDC.
amendment to put together a policy.
Yes,
That work?
okay.
For my grant requirements, I had to have all of these policies in place for my grants for FEP, emergency preparedness. And so I have a booklet here so that we get our grant money. Also talks about schools, HIPAA, that kind of thing. So there's actually a whole book.
Okay.
And these are requirements so that we get our money from the state. We have to have these policies in place. So I can forward them all to you if you want. They're pretty boring though.
So you amend your motion
Yeah.
to include those? Okay, so the motion's been made. Is there a second to the amendment?
I would second.
Okay, the motion's been made and seconded to amend the motion to also include the CDC guidelines. Is there any further discussion? All in favor? Aye. Opposed, same. Motion carries. Okay, next on the agenda is old business. Public Health Officer.
I didn't know that there was any old.
So there's no old business, okay.
We still need to address the school decision, 50-2 and 15 that you mentioned.
I don't know, did
They have not yet.
they? Yeah.
Public Health Nurse, do you have anything for us, Teresa?
Actually, do. So, I kind of wanted to go off of what Dwight said a little bit too, for the hundreds of people who have come to our facilities to get vaccinated. Vaccines do work. That is a proven fact. There's science behind vaccinations. There's many, many diseases. Doc Dwight can attest to the fact that many diseases are eradicated because of vaccines. So, I just wanted to put my 2 cents in there, and I still believe that the reason we don't have any flu this year is because people are washing their hands, they're wearing masks, and they're social distancing. So, one thing that I think that Montanans can be proud of is that we're the top performer as of today in giving COVID vaccinations. So, that's really a good thing. The FEP, Emergency Preparedness, is going to, has applied for funding from the federal government to get us funds for support for vaccines, so we can cover our costs for administration of vaccines. They put in that application, I believe, last week. And they're coming out with some specific messaging templates for local health departments. Everybody is so busy trying to get COVID vaccines out there and doing contact tracing and COVID investigations that nobody really has time to put together the information that the public wants to see. So the state is going to do some templates, so we'll be able to put that, tweak it for our county and put it out there on whatever media we decide to use. The health department does have a Facebook page now. I am trying to update that daily, at least put on the numbers. Our active cases today are 7. That's phenomenal. They haven't been that low since March. It's crazy. But we have to remember that we were near 60 active cases per day not that long ago. So we just have to keep that in mind when everybody's being responsible for themselves. We're also going to put a little graph type paragraph in the paper every week with the statistics. That's what I'm hearing people want is how many cases, how many total cases we have, how many deaths, what our daily count is every Wednesday, how many vaccinations we've done in our county, and then any updates on the vaccines. As you probably have heard that there's a new vaccine coming out. We don't know when or if Montana will even use that vaccine right away. So I have a concerned citizen call. I don't know if this is appropriate time for that. Apparently, groups of high school kids and individual high school students are using the stairway on the back of the professional building. It's been deemed unsafe by an inspector. This person wants to stay anonymous, but does not want the kids to climb all the way to the top of that in a group and have it tumble down on them. It's a big stairway. I see it right from my office, and I have worked on the weekend and seen kids over there taking pictures, and I wasn't sure why they were there, and then I realized they were taking pictures. And so I was kind of hoping Lynn would be here today, but if you guys want to make a vote on that, generally how it works, if somebody calls and says something is unsafe or needs to be condemned or something, Doc and I go look at it. We've done that with trailer houses that are abandoned, homes that have been on fire and still people living in them. We condemn them, and then the sheriff's department goes and puts their tape around and puts up notices. So this citizen is really wanting us to do that, just so that 5 or 6 kids don't climb them steps and have the whole thing come tumbling down on them. I did visit with Dr. Campbell about that this morning, and he agrees. So I guess with your permission, I can ask Lynn to take that off if everybody is.
I think you could do that and then maybe approach the city's building inspector or talk to Eric Crush.
Has the owner been contacted?
No, I just got this late yesterday, like after 5 yesterday.
Probably need to do an inspection first, talk to the owner.
Okay. She did say an inspection was done, but I didn't ask where that record was. That's all I have.
Thank you. Report from Board of Health members. Anybody got anything? No? Okay, we'll move on to Board of Health bylaw updates. You guys got these?
Yeah.
Okay, so the update is Article 2, the membership. The board council shall consist of a county commissioner and two county commissioners and 2 members who are appointed by the county commissioners and serve at their pleasure, or a minimum of 5 persons who are appointed by the county commissioners and serve at their pleasure. The addition is the or a minimum of 5 persons who are appointed to the county commissioners and serve at their pleasure. That's the change. And then the other one was the meeting dates, I believe.
Article 4.
Monday to Wednesday.
Okay. Currently says Monday, and we've been meeting on Wednesdays because Mondays were too hard to get people to the meeting, so.
I would move to accept the bylaws as submitted.
I'll second.
Any further discussion? All in favor?
Aye.
Aye. Opposed, same. Motion carries. Okay, next on the agenda, election of officers. The nominations will be open for chairman.
I'll make a nomination to keep Mike as the chairman.
Thank you.
Jump on that right quick.
Thank you for doing that, right? I would second that.
Motion's been made and seconded. Have Commissioner Delger remain as the chairman of the health board. Is there any further discussion? All in favor?
Aye.
Opposed, same. Motion carries. Okay, now the nomination for the vice chair.
Now's your chance to get it back.
Letting this play out.
Well, I'm on a roll. I'll make a nomination to appoint our other county commissioner, once on the board, as the vice chair, Debbie Randall.
Is there a second?
I'll second that.
Motion's been made and seconded to nominate Debbie Reynolds as the vice chair.
Randolph.
What's that?
Everybody said Reynolds. It's Randolph.
What's that?
You said Debbie Reynolds.
Oh, I'm sorry.
Our generation
Where'd that,
does
you know where
that.
that came from. Debbie Randolph, I'm sorry.
Happens a lot.
Any further discussion? All in favor?
Aye.
Aye. Opposed, same. Motion carries. Let's see next, the county sanitarian Rocky Mountain Supply deviation request.
Okay. So I think this is the other reason Robert is still here. So I introduced this project to you guys a couple meetings ago, I guess in the January meeting. And so I'll just go over it briefly with you real quick. And oh, I do have extra copies. Do people need copies of this? I had them ready for you guys last week. I'm sorry. Okay, Helen, will you pass these down? Okay. So Rocky Mountain Supply is, as you all are probably aware, getting ready to build a new facility south of town. And one of the amenities that they're hoping to provide for the community is an RV dump. And in discussions with Robert and his consultant, we talked about what's the best way to dispose of the RV waste. That the site that they're moving the new facility to will be on an on-site wastewater treatment system, a drain field septic system. And I'm not a big fan of trying to get rid of RV waste in a drain field or septic system when we don't know exactly what kind of flows we're going to have, and it's going to be very seasonal. So we talked about the best option is to move to a holding tank where the RVs will pull in, it dumps into a concrete septic tank that just doesn't have an outlet, it doesn't go into the soil. That holding tank then is pumped by a state licensed septic hauler and disposed of either at a wastewater treatment plant or a state approved location, which is they can land, apply it, it has to be tilled or it has to be limed. And those sites go through an environmental assessment before they can be approved. And so I have been promoting this solution because I think it's best for our community in that it's not going to discharge into the groundwater. And it's just really a tricky situation of how much flow do you have going into from the RV waste. So in order to go through this, it's funny, our regulations don't actually preclude the use of a holding tank for this situation for recreational use. However, we have adopted DEQ4, which is the Montana standards for on-site wastewater. And in that, it says for new subdivisions or new projects, you're not allowed to use a holding tank. And so the consultant for Rocky Mountain Supply provided a waiver from that regulation to our department for our review and then to bring it forward to you. So that's what you have in front of you. I think you can, I provided a layout showing where the proposed Rocky Mountain Supply is. It should be maybe the third page. I've also provided their the waiver request from Craig Dalton, who's their consultant. Typically, what we have to look for in the deviation is how is this going to impact the environment? Are there any detrimental issues to the public? And this one was kind of it's kind of a no-brainer because it's not discharging, so it's not going into the groundwater. It's not going to be causing any effects to the environment. And so as we go through the deviation criteria, basically it's saying we're not doing anything, there's not a problem. And so that's what, in Part C, we look through the analysis of the deviation criteria. And when we go through those, it basically just says it's not going to cause pollution to state waters. And it's not going to affect the public health and safety and welfare. So with that, because it's fairly straightforward, I did provide in the conclusion portion, page 3 of 4, I don't know why it's, 3 of 4, indicating what the conditions that I would recommend that you approve this deviation. And those are, of course, that they pay the appropriate deviation fee and a permit fee for the tank. The holding tank must meet the criteria of DEQ4. And it needs to basically meet all the standards of that section 20, except that no outlet is going to be put on that tank. It needs to have an alarm, and the alarm has to be set so that once the tank reaches a level of 75%, that the alarm will go off so that they know that they need to get it pumped. And in this particular area, it's going to be important that they make sure that the tank is not going to be buoyant. There is high groundwater or potentially high groundwater in that area. And so we want to make sure that because the tank gets pumped out, it doesn't have the liquid in there to hold the tank down. So a lot of times your septic tank won't pop out of the ground because it's so full of water. But in this case, they'll pump that out. And what we don't want is that to happen during the high groundwater, and then all of a sudden their parking lot gets this concrete tank flying out of the ground. And it does happen. I mean, I've seen it. So and it's a simple calculation that the engineer can do just to make sure that the tank doesn't, that it may need a concrete pad poured over it or something just to help weigh it down. There's simple ways to handle that. Of course, the holding tank has to meet all the separation distances to wells and that type of thing. So there's a table that we follow in our regulations and in DEQ4 and in the ARMs. And finally, the one thing that I would like to see is that the applicant provides a letter from a local septic pumper saying that they can actually do this, that they have the capacity to pump a tank. And I'm not thinking there's a problem there, but each pumper has a certain amount of land that they can use for applying their septic. And we need to just make sure that we're not going to put them over their limit with this project. So those are my recommendations. Are there any questions about the deviation or waiver request?
Sean, I have a question. If we require them to have a letter from a specific pumper, is that going to limit them to only having one person to use instead of going out on the market and using other pumpers that may provide the service?
That is not my intent. I just want to make sure that there is somebody available. So anybody, they may even decide that they want to buy their own pump truck because it's cost effective. You know, you just never know. And I've actually seen that happen where someone is on a holding tank. They buy their own truck and then they get the permits and everything to do all that. So did that answer your question?
Yeah.
So where is this holding tank? What's its proximity to the drain field?
So the holding tank, my understanding, Robert, and I'm sorry, they sent me this drawing after, but of course that was last week, but and I could have printed it out. But it's going to go. The drain field is going to go in the area that is kind of the eastern portion of the property. If north is up on here. And the holding tank, my understanding, is going to go in the northwest portion of the property, based on kind of how the flow is going to go.
Okay.
But yeah, that's according to Craig Dalton is the consultant for the project. And he's available. All I have to do is call him if you guys feel like you need to talk to him. But I told him I felt like this was fairly straightforward, so I may be misleading him. But
Mr. Chairman, you just need a motion?
Yes.
I'll move that the board approve this holding tank deviation with the exclusion of requiring them to submit a specific company to dump their tank. And the reason for that is that if for some reason that person or company could not do it and they were 75% full, that they could find another company in a fairly quick time without having to go through getting approval.
Is there a second?
I'll second that motion.
Motion's been made and seconded to accept the deviation for Rocky Mountain Supply holding tank with the caveat that we have a letter stating the local septic tank pumper can handle the capacity of the tank when it gets to 75%. Is there any further discussion? All in favor?
Is that what I said?
What's that?
I don't think that's what I...
Dwight removed that caveat.
Remove that caveat.
Oh, remove it? Okay.
Yeah. So that they have the freedom to
Okay. Okay, is there a second?
I'll second that.
Already had a second. So the motion's been made and seconded. All in favor?
Aye.
Opposed, same. Motion carries.
Thank you.
Okay, next, report from the public health officer. Doc, you got anything?
Oh, I think you all covered everything.
Okay, thank you. Anything from board members?
Can I go back? I guess I need clarification. Corey talked earlier about basically a letter of support from us, from the Board of Health, for the school and the county to make their own decisions on their property regarding masks. I think Corey quoted 50-2-116.
Yeah, that's what I have too.
And I would move that we write a letter of support.
To both those.
And I don't know if it needs to be more than a letter of support, Corey, from the Board of Health to the school and the county.
I think it would make sense that the board adopt a policy permitting the school board and the county commission to require masks and other social distancing measures within their facilities under the authority of the county commission and the school board to regulate their facilities. I just think, and that would be under, the powers of the Board of Health are the 50-2-116. And the reason I'm saying that is because they have an inherent authority to do so, especially, but, we're hearing today, people are saying the county commission can't do that. Yes, they can do it. But the Board of Health is ultimately the entity that makes the public health directive. So if you're passing that and saying these entities are authorized to do it, the other thing it permits is, particularly with the school, they also have to comply with high school association rules as to basketball games or whatever the activity may be. And so I think that it would just be helpful to authorize them to not only govern their own facilities, but also to implement regulations specifically as part of their school association.
Okay.
So I would move that we adopt the Board of Health adopt a policy supporting the school and the county. Help me out with wording, Corey.
And I guess, if you want, when do you think you're going to have your next Board of Health meeting? Probably, hopefully not every week, right?
That would be ideal.
Yeah.
Great.
So I would just say authorizing the school board and the county commission to implement social distancing and masking measures for their facilities and personnel, and probably with the school board governing any extracurricular participation with appropriate organizations. And I wouldn't just limit it to Montana High School Association, because it might be FFA or it might be some other entity. But I think extracurricular activities would likely cover that.
So is this something that we could do at our next meeting?
Well, I think if you want to pass it now, and then it could be, a letter's drafted and signed by the chairman of the
Okay.
board.
Sounds good.
So is there a motion then?
I'll
Want to
move
reword
what
your
Corey
motion?
said.
We do.
Well, there's some comments.
Vicki Rouser wants to know what about the city?
Yeah, so is there a city, there's not a city board of health, is there? And so we're not a joint city-county one where the city doesn't appoint members? Okay. Yeah, so you could do that. You could authorize the city to regulate its
okay.
facilities.
Yeah.
Its facilities as directed by the city council. Again, under local government law, the city has the authority to do so. But, I know that this is going to be, this authorizes them to make those decisions. It doesn't force them to make those decisions.
So is there a motion then? What is the motion?
That's what I'm trying to. try this again. I would move to give the city, county, and the school authorization to state their own policy for mass social distancing, anything else related to COVID.
Okay.
Within their facilities.
Within their facilities and their activities.
Is there a second?
I'll second that.
Motion's been made and seconded. Any further discussion? All in favor? Aye. Opposed, same. Motion carries. Anything else? Seeing nothing else, we will adjourn at 1:32.